Safe handling. Cancer chemotherapy should be administered by professional registered nurse who successfully completed a course of chemotherapy administration as recommended by ONS. View the ONS position and education of the professional RN who administer the care for individual receiving chemotherapy and biotherapy. Available on the ONS website. The ONS Cancer Chemotherapy and Biotherapy course include information on safety protocol for preparation, administration, and disposal. This section will review this principle: general safe practice consideration, transporting hazardous drugs, safe handling issue during hazardous drug administration, safe handling issue for body fluids, and linen after administration. General safe practice consideration. According to occupational OSHA, safe level occupation exposure to cytotoxic agent can be determined, and no reliable method of monitoring exposure of currently existing potential health risks for exposure to chemotherapy drugs are based on inherent toxicities of the drug. It's imperative that those who work with cytotoxic agent adhere to safety practice recommendation designed to eliminate or reduce occupational exposure. Studies that document cytotoxic contamination of worker and environment in the drug preparation administration area, a 1999 evaluation 6 cancer center in the United States and Canada found that 75% of surveys with pharmacies have detected level of antineoplastic agent. Therefore, healthcare workers both directly and indirectly involved chemotherapy preparation administration may be exposed to the harmful effect of this agent. Characteristics of the hazardous drug: carcinogenicity, genotoxicity, teratogenicity, fertility impairment, organ toxicity, and other acute symptoms. Potential route exposure from cytotoxic biotherapy agent. The healthcare provider may expose a hazardous drug through a variety of methods. Absorption most likely through skin, mucous membrane following indirect contact of the drug contaminated surface. Injection by accidental needle, stick, or contaminated sharp. Inhalation of drug, aerosol dust, and droplets. Ingestion of contaminated food, beverage, tobacco, and product. Introducing withdrawal needles from vial, transferring drug with needle or syringe, opening ampule, expelling air from the drug-filled syringe or tubing. Administration of hazardous drug, priming, spiking, changing IV tubing and bag, entering or puncturing closed system, handling leakage from tubing, syringe to connector site, disposing of agent, material, and equipment, handling body fluids and contaminated linens with 48 hours after administration, managing hazardous drug spill. Personal protective equipment, PPE, is required in all situations. Just discuss this risk exposure hazardous the following area most recent recommendation: gloves, gown, and face shields. Respirator. Risk of not using PPE. Many seasoned nurses are cavalierly about not wearing fully recommended PPE, especially appropriate gown when administering chemotherapy as recommended by OSHA. It is important to remember that it is not known what could be the effect of chronic low-dose exposure to chemotherapy. We don't know now from study conducted in other countries as well as the United States prior to the adaptation of PPE. The following event can occur. Turkish nurses who handled cyclophosphamide chemotherapy for 4 consecutive days had detected level of cytoplasm in their urine. Healthcare workers who have been exposed to hazardous drug have reported acute symptoms of skin irritation, sore throat, cough, dizziness, allergic reaction, diarrhea, and nausea, vomiting. Safe handling issue while mixing hazardous drug. Staff should be properly trained use the BSC, wear appropriate PPE including gown, double gloves. Safe handling issue during administration. Always wear PPE. Designate a work or handling agent. Work below the eye level. Know and ensure the location of the spill kit receptacle. Place disposable absorbent plastic backpad underneath the work area. Use lower lock connector needles. Avoid priming tubing that meets their side. This must be done prime tubing. Place gauze pad under the needle or syringe at injection port. Keep IV equipment observation set intact whenever possible. Use detergent water to wash the surface come in contact. Discard all material PPE in acceptable toxic waste receptacle. Safety issue handling body fluids and linen after administration. Just with potential contact and body fluids. Standard precaution with institute handling the excreta, blood, vomitus, and receive chemotherapy in the previous 48 hours. Keep in mind that splashing may occur. Take all PPE precaution for incontinent patient. Cleanse the patient's skin well and apply protective area to the skin. Change diaper frequently. When disposing urine feces in toilet, patient have received cytotoxic agent within the past 48 hours. Flush the toilet with the lid down. And there is no research to support effectiveness of double flushing, but it may be helpful with low volume flush. If urinal or blood pan is used, should be covered. Linen should be protected. Managing cytotoxic spill. Spill kit should be available wherever hazardous drugs are stored, transported, prepared, and administered. Each individual working hazardous drugs should be trained in spill cleans to decrease exposure. Safe handling activity. Safe handling activity. You can spot unsafe practice as you review the following picture. Roll your mouse area so it make changes. Lesson review. General safe practice consideration. Extravasation. Extravasation is an unwanted potential devastating side effect of chemotherapy administration.